Hi, Paul with you on Canberra's 1WAYFM. According to Osteoporosis Australia, someone in Australia is admitted to hospital with an osteoporotic fracture every 5 to 6 minutes, and this figure is set to rise as our population ages. Sam Kleiner works with MeasureUp, an organisation seeking to help diagnose osteoporosis, particularly through the use of DEXA technology. Sam, thanks for joining us on 1WAYFM.
Hi, Paul.
To start off, a lot of us have heard of osteoporosis, something affecting the bones. But can you explain a bit further what exactly it is?
So osteoporosis is what occurs when bones become weaker, usually due to the fact that people are losing minerals. As you become older, the body is able to replace minerals that go to the bones a lot slower, and therefore bones become weaker and then more susceptible to breakages.
Okay. Who does it typically affect?
Osteoporosis typically affects the older population, although it does sometimes affect younger people as well. Amazingly, the statistics are 1 in 2 women and 1 in 3 men who are over 60 in Australia are affected by osteoporosis.
Wow, that's pretty incredible statistic. Are there any symptoms that people can look out for?
Well, often people will get pain, maybe a difference in posture, or even start losing height, and they'll blame that on being old. A lot of the time, though, it just has to do with osteoporosis. People often have fractures in bones or even sometimes in their spine, and a large percentage of them go undetected. As I said, people often blame this on just becoming older.
Yep. Sam, you work with MeasureUp. Can you tell us a bit about that organisation firstly?
Yep, so our organisation, MeasureUp, utilizes DEXA scanning. What we do is we've developed a technology by ways that we've made the service mobile. It's very similar to breast screening vehicles, if you've seen them around. The difference here is that our service offers this DEXA scanning, which is able to tell people's bone density. And as I said earlier, osteoporosis is when people's bones become a lot less dense. And therefore, with this DEXA scanner, we're able to tell which people are at risk of osteoporosis and hopefully try and avert the disease.
Yep. I was reading earlier that there are some technologies out there saying that they can indicate to you whether you do have osteoporosis. Is it true that we should just trust whatever we see, and how does the DEXA technology differ from some of the other technologies they offer?
Well, you might actually see often in chemists and some shopping arcades technology called heel ultrasound. The thing with heel ultrasound is that it's actually a non-diagnostic service.
Yep.
And your doctors aren't able to use the results to check for osteoporosis, and to that end Medicare wouldn't cover the procedure. So in effect it's really a waste of money. With DEXA, however, you're able to tell exactly how dense a person's bones are, and DEXA is known as the gold standard for measuring osteoporosis.
Okay.
It gives you what's known as a T-score, which the doctors are then able to correlate against normal scores, and then able to see if you're osteopenic, which means you're at risk of osteoporosis, or if in fact the person has actually developed the disease.
Okay, so it's able to tell in advance whether someone may develop it at a later stage. That's great.
Yes, that's
okay.
correct.
You're going to be in Canberra in December. How can people organise to have a checkup with this DEXA technology when you're in town?
Well, we're coming specifically to Fisher. We're coming there on Monday the 12th of December, and we'll be there all week until Friday the 16th. If people would like to make a booking, they can call us on 1-800-101-163, and that's a free number. We're coming back to the area again in the middle of February. So if people aren't able to make the bookings, if they can also give us a call, and we'll be able to put you in for February.
Okay. Do they need to organise anything with their GP in advance?
They'll need a referral from their GP.
Yep.
If they like, they can call us for which GPs are giving out the referrals, and we'll be able to direct them.
Sam, does this service cost anything?
Well, actually no. Anyone who's over 70 is covered fully by Medicare. So the patients don't have to pay anything and the practices don't have to pay anything to have our service. As well as that, there's a list of Medicare numbers on the referral, so many people would also be covered by that. The other Medicare numbers include things such as chronic liver disease, chronic renal disease, prolonged use of steroids, and there are a few other conditions which are covered. The best thing is for a person to speak with their GP if they think they're particularly at risk. We generally would recommend anyone from 50 and up to go and talk to their GP about our service, just so that they're able to prevent osteoporosis at an early stage.
Okay, to make a booking for the DEXA technology, which scans for bone density, give them a call on 1-800-101-163. They're going to be in Canberra in the suburb of Fisher from Monday the 12th of December going through till the end of that week, Friday the 16th of December. For more info, check out MeasureUp.com.au. Sam Kleiner, thanks for joining us on 1WAYFM.
Thank you, Paul. Thanks for having me on.